Hello, friends. This is Dr. Manju Gupta, Senior Consultant Obstetrician and Gynecology from Motherhood Hospital, Noida. So, many of you have the query that what special precautions, do's and don'ts regarding nutrition and lifestyle we should be taking while we are preparing ourselves or while we are having an IVF pregnancy. As such, there is nothing special which we do need to take care during IVF. But yes, since it's a special pregnancy which is conceived through IVF, or your body is going to have multiple hormones, injections, and many more medicines as compared to a normal pregnancy. So there are special things which we should take in mind, which you should keep in your mind before preparing your body for that or going for IVF pregnancy. For example, before planning for an IVF pregnancy, you should be having an adequate weight so that the success of the IVF is more. So preparing your body with a healthy nutrition and diet is very important. Adequate amount of folic acid, folic levels should be there in the body. So prior to the pregnancy, 3 months we say folic acid should be taken prior to planning of the pregnancy, any pregnancy for that matter. Apart from that, diet is very important. That healthy diet in terms of balanced carbohydrates, fat, protein should be taken so that our body is healthy and accept the pregnancy in a nice way and the success increases. Moreover, when you have conceived, then also pregnancy goes well. The chances of you developing blood pressure or high sugar levels, diabetes, are much lesser if adequate weight is there while you have conceived the pregnancy. Omega-3 fatty acids are important for brain development of the baby initially from the second trimester, beginning of the second trimester. Omega-3 fatty acid intake, which can be in the form of fish or walnuts, nuts, seafood, should also be included in the diet so that adequate brain development of the baby happens. It is nothing different from a natural pregnancy, but yes, more requirement is there because most of the times IVF pregnancy are later in the age group. So dietary requirements are much more than what is required in early age pregnancies. Apart from that, adequate exercise and rest is also very important. Exercise because of the hormones, some women tend to gain much more weight than what is required or what is optimal. So adequate exercise under supervision is very important. Similarly, rest, adequate rest, which is 2 hours of day. We say you should take 2 hours of sleep in day and 8 hours of sleep at night is very important. That will lead to your brain to take adequate rest. Your baby will grow well if you take that much of rest. Apart from that, there are certain don'ts which we specify. For example, a lot of people do a lot of researches on Google and they tend to follow those. So that is something which is not advisable because that will give you unnecessary stress and you may lead to unnecessary malpractices and all. So unnecessary Googling should not be done. Exercise only under supervision should be done. We should not be doing exercises just by looking into the Google because that may lead to preterm labor. Traveling, some people believe in going for staycations and baby moon and all. We say it is better to avoid traveling during pregnancy, any sort of traveling. Local travel is okay, but unnecessary traveling can lead to preterm labor, can lead to rupture of membranes, water break, and unnecessary abdominal pain and all. So travel should be avoided as much as possible. Apart from that, caffeine intake should be minimized. Tea, we say it is allowed, but especially not more than 2 cups per day. Alcohol in any form should be avoided during all kind of pregnancies. Stress, yes, we should learn how to handle our stress well so that it does not affect our pregnancy in terms of growth, nutrition, in terms of baby growth, and stress can also lead to preterm labor. So stress management is very important in all kind of pregnancies. Sleep, as I said, so there are few things which we tend to neglect. Sometimes women are overburdened by their office work and all. So sleep is very important. That adequate sleep is required. Less of screen time with adequate sleep is something which can help you in maintaining the healthy outcome of the pregnancy. Thank you.
Motherhood Hospitals. We care like no other.